Hello learners. Did you know about shoulder joint? So keep an eye out and learn about. It is a joint between head of the humerus and glenoid cavity of the scapula. This joint is a ball and socket type of synovial joint. It is the most movable joint of the body, and consequently one of the least stable. It is most common joint to dislocate and to undergo recurrent dislocations. In this article, we shall look at the anatomy of the shoulder joint, its articular surface, ligaments, bursa, relations, blood supply and movements. Articular surface of shoulder joint. The shoulder joint is formed by articulation of large round head of humerus with the relatively shallow glenoid cavity of the scapula. Therefore, it is also known as the glenohumeral articulation. Structurally, it is a weak joint because the glenoid cavity is too small and shallow to hold the head of the humerus in place. The head is 4 times the size of the glenoid cavity. However, this arrangement permits great mobility. Stability of the joint is maintained by the following factors. 1. The coracoacromial arch or secondary socket for the head of the humerus. 2. The musculotendinous cuff of the shoulder. 3. The glenoidal labrum helps in deepening the glenoid fossa. Ligaments of the shoulder joint. 1. The capsular ligament. The thin fibrous layer of the joint capsule surrounds the glenohumeral joint. It is very loose, and permits free movements. It is least supported inferiorly where dislocations are common. The capsule is lined with synovial membrane. 2. The coracohumeral ligament. It extends from the root of the coracoid process to the neck of the humerus opposite the greater tubercle. It gives strength to the capsule. 3. Transverse humeral ligament. It is a broad fibrous band, which bridges the bicipital groove between greater and lesser tubercles. This ligament converts the groove into a canal that provides passage to the tendon of long head of biceps brachii. 4. The glenoidal labrum. It is a fibrocartilaginous rim, which covers the margins of the glenoid cavity, thus increasing the depth of the cavity. Bursa related to the shoulder joint. Several bursa are related to the joint, but the important ones are as follows. Subscapular bursa. It lies between the tendon of subscapularis and the neck of the scapula, and protects the tendon from friction against the neck. This bursa usually communicates with the joint cavity. Subacromial bursa. It lies between the coracoacromial ligament and acromion process above, and supraspinatus tendon and joint capsule below. It continues downwards, beneath the deltoid. Hence it is sometimes also referred to as subdeltoid bursa. It is the largest synovial bursa in the body, and facilitates the movements of supraspinatus tendon under the coracoacromial arch. Relations of the shoulder joint. The shoulder joint is related to superiorly coracoacromial arch, subacromial bursa, supraspinatus, and deltoid. Inferiorly, long head of the triceps brachii, axillary nerve, and posterior circumflex humeral artery. Anteriorly, subscapularis, coracobrachialis, short head of biceps brachii, and deltoid. Posteriorly, infraspinatus, teres minor, and deltoid. Within the joint, tendon of the long head of the biceps brachii, blood supply of shoulder joint, anterior circumflex humeral vessels, posterior circumflex humeral vessels, suprascapular vessels, subscapular vessels. Nerve supply of shoulder joint, axillary nerve, musculocutaneous nerve, suprascapular nerve. Movements of the shoulder joint. The shoulder joint enjoys great freedom of mobility at the cost of stability. There is no other joint in the body which is more mobile than shoulder joint. This wide range of mobility is due to following factors. 1. Laxity of joint capsule. 2. Articulation between relatively large humeral head and smaller and shallow glenoid cavity. The glenohumeral joint permits four groups of movements. Flexion and extension. During flexion, the arm moves forwards and medially, and during extension it moves backwards and laterally. These movements take place parallel to the plane of glenoid cavity. Abduction and adduction. During abduction, the arm moves anterolaterally away from the trunk, and during adduction the arm moves posteromedially towards the trunk. These movements occur at right angle to the plane of flexion and extension. Medial and lateral rotation. These movements are best demonstrated in mid-flexed elbow. In this position, the hand moves medially in medial rotation, and laterally in lateral rotation. Circumduction. The circumduction at glenohumeral joint is an orderly sequence of flexion, abduction, extension and adduction or the reverse. During this movement the upper limb moves along a circle,